Hello everyone, my name is Dr. Aditya Gupta. Welcome to this video. In this video, I wanted to cover something which is important from your examination point of view and also for general public actually. So this is about androgenetic alopecia. The reason I'm covering this video is because one of my brothers was going to get married very recently, said that he's having a lot of hair fall, and it was a typical androgenetic alopecia which all us doctors know about. So I just thought let me just do a video about that. So the first one is what is androgenetic alopecia? As the name suggests, it is basically male pattern baldness. Having said that, it can occur in females as well. Now, it happens because of androgens, and the typical etiology, that is because there is the something called as miniaturization that occurs. So, normal the hair that is present on our head, that is present in our axillary hair, the hair that is present in our pubic hair, they are what is known as a terminal hair. They have a thick medulla. What happens is because of the androgen effect, they get terminated into vellus hair, which is a thin hair that is present over our skin and all over our body, and then hence get fallen off. They're thin and get fallen off, and that leads to alopecia. It is androgen dependent. Most importantly, how do we know this? Because males who have been castrated in their puberty do not have this androgenetic alopecia, and it can happen in females as well, but the pattern is different. Now, the pattern of hair loss in males is what happens is typically you will have something that it will start from the edges of the frontal hair, and then it will cover the vertex. Occiput typically is spared. This is one thing that you need to remember from your NEET PG point of view as well. That it starts from here, it involves the vertex, and occiput is typically spared. There's something called as the Hamilton-Norwood grading that grades this type of alopecia. Again, the name can be asked, not exactly what is there. But as you can see, initially starts from the frontal part, then goes on to involve the vertex, and then the entire area. But occiput, even in the worst stages, is spared. This is something which we all know. All our dadaji and all our grandparents tend to have this thick amount of hair present here, but they have essentially been balded from the vertex and the frontal area. So remember that. Now, females can also have androgenetic alopecia. In such case, you always remember to take a history about PCOS and symptoms, similar to symptoms, because they're having an androgen axis. Here, the system classification is called as Ludwig classification. And in case of Ludwig classification, they rather have something called as a central parting. The hair fall is in the central area rather than the frontal and the vertex that occurs in case of males. Now, what is the treatment? Now, essentially, the treatment revolves around improving the hair circulation. And you can use multiple methods to improve that hair circulation as far as treatment is concerned. Now, the first and the foremost that is used worldwide and we all know is minoxidil. Now, minoxidil was initially invented as a antihypertensive. It was invented as an antihypertensive. It was something which was used as an antihypertensive because it was a potassium channel opener. It was a potassium channel opener. So potassium is going out of the cell. There will be hyperpolarization, and there will be dilation of the blood vessels. The vessels won't contract. They will instead dilate, and this will improve the blood flow going to your vertex, going to your hair, and this will result in more improving the circulation, and this improving the circulation instead in turn would result in more hair growth. It was in fact found as a rather a side effect. Initially it was used as an antihypertensive, and then later what they found, these individuals found was these during the trials of this as an antihypertensive, that one side effect was they were having excess of hair growth, they were having hypertrichosis. So they reimagined that product, minoxidil, as a product. So topical minoxidil is what is used by most products, and that's what I recommended to my brother. At the same point of time, what has been realized is that just using minoxidil causes decrease in compliance, and that is the reason a lot of massage and hair oil products are essential as far as giving a treatment of androgenetic alopecia or hair loss in males is concerned. So what happens is when you're massaging your hair, if you're massaging your hair, again, the blood circulation is going to improve, and as the blood circulation will improve, that blood circulation improvement in blood circulation will result in an improvement of your hair loss, improvement of your hair loss. This improvement in blood circulation. So I'll recommend one product that I have used myself at times. This is Mars. This is a company, as we all know, women are from Venus, men are from Mars. So this is a company specifically for hair loss products for males. Mars by GHC. You can consider using them. They are a really good products. Again, the way they act is similar. They will improve the circulation. You can massage your hair with this. It will improve your compliance. It will improve your circulation, and as a result, it will promote hair growth. So if you're someone, it can occur in 20-year-old or 30 years old. If you're someone from hair loss, minoxidil and these are the two main growth products which you can, any hair oil you can use them in order to improve your compliance, in order to improve your hair growth, and in order to improve the circulation of hair. Massage has many benefits. We all know that. getting a good massage every 2 to 3 days will improve the compliance, and at the same point of time uh, improve your hair growth and decrease the hair loss. At the same point of time, you can check out other products. There are specific men's company. You can check out other products. If you like, you can buy them. Apart from that, anti-androgens. Now, and since I said everything is about androgens, anti-androgen finasteride is a drug that is used. And last but definitely not the least, hair transplant. We all know Virendra Sehwag and Gautam Gambhir, they all got hair transplant done. It's common public knowledge. And hair transplant is now being accepted by a lot of people in our society. And there's nothing wrong with that. What's wrong in looking good, for that matter of fact. Now, what the concept of hair transplant is, basically the occipital hair, they're considered insensitive to androgen. So since they're considered insensitive, those hair follicles are then reimplanted on the hair, and then that's used as a, the hair growth and the transplant. So these are the treatment options. First is minoxidil. Second is any hair product. I will recommend this mask by GSC, a specific hair growth a specific men's company. It will improve circulation. Both these things will improve circulation, improve your blood circulation, increase in the hair growth. Last is anti-androgen and transplant. Thank you. I hope you enjoyed the video. You can find the link for this product in the description below. Thank you.